Hello, everybody. I wanted to talk a little today about what to expect after your balloon sinuplasty procedure. Balloon sinuplasty is a procedure that I commonly perform in the office, and it's used to treat chronic sinusitis or recurrent sinus infections. I think I have some other videos that talk more about the procedure. This video is really to give you an idea of what to expect afterwards if you have the balloon sinuplasty procedure yourself. Um, so typically when I perform these procedures in my office, we give our patients a little light sedation. So after you're leaving the office and going home, you'll probably be a little groggy and sleepy. So normally most people are going to go home and take a nap for a couple hours. Another thing you'll be feeling as you're leaving the office is your throat's going to feel funny. And the reason for that is a lot of the numbing medicine that I put up into your nose, some of it ends up dripping into your throat. So it makes your throat feel weird. It feels like it's swollen. Your voice can sound funny. Some people are pretty irritated by it and are kind of coughing and that a lot. But that will wear off, usually within 2 hours to maybe 3 hours after you go home. So typically what happens is people will go home, take a nap. By the time they're waking up from their nap, their throat is coming back to normal again. Once your throat feels good and you can feel things when you're swallowing, at that point it's safe for you to eat and drink anything that you normally would. As far as your nose is concerned, it's pretty normal after the balloon sinuplasty procedure to have sort of a slow amount of oozing and bleeding, definitely for the rest of the day of the procedure, and sometimes off and on for a few days afterwards. That's totally normal and expected. The amount of bleeding that would worry me and would warrant a phone call to my office would be if a piece of gauze under your nose gets soaked with blood, like you dropped into a bucket of blood in a span of 5 minutes or less. And knock on wood, out of more than 200 of these I've done, that's never happened. So it's pretty unlikely you'll get that amount of bleeding. But that would be the kind of bleeding that would concern me and I'd like to hear about. Anything less than that is pretty much expected, and it will slow down and stop, usually pretty quickly. As far as the pain and discomfort you'll have in your nose, I would say the average patient who gets this procedure is sore for a day or two, to where maybe they would need to take some sort of pain medicine for it. I prescribe a medicine called diclofenac. It's a similar medicine to Advil or Aleve. It's just a little bit stronger than those. I've been prescribing this for about a year now for these procedures, and it works great. I don't think people need, opioids or stronger pain medicines. Usually the amount of pain with a balloon sinuplasty is pretty tolerable for most people. So you may need to take that diclofenac medicine for a day or two. I do find that a lot of my patients tell me they never take any pain medicine after this procedure. But I'd say the average person may need to take a few doses for 1 to 2 days. After that, the pain goes away, but most people are just feeling kind of some sinus pressure, almost like you're developing a sinus infection, and people get pretty stuffy and congested in their nose. And that stuffiness, I think, usually starts to turn a corner and improve about 1 week after the procedure. So I would expect to be sore for a couple of days, and then pretty stuffy for about a week after this procedure. So I hope that's helpful for you. I would certainly encourage you to consider the balloon sinuplasty if you've been struggling with a long-term history of sinus infections, chronic sinus pressure, and congestion. It's done wonders for a lot of my patients. So anyway, I hope this video was helpful for you, and give me a call or come in and see me if you have questions. I'll talk to you soon.